Alright, this is a video presentation on the Rubella virus by Jeff Moody, Tyler Traversa, and Michael Tolan. So a little bit about the history of the Rubella virus. It's also known as German measles. It gets this name because it was first described as a separate disease by German physicians in 1814, resulting in the name German measles. It's a common infection in many areas around the world. About 100,000 cases of congenital rubella syndrome occur each year. The largest annual total cases of rubella in the United States was actually in 1969, when 57,686 cases were reported. Rates of disease have decreased in many areas as a result of the vaccine, however. In April of 2015, the World Health Organization declared the Americas free of rubella transmission. And a fun fact, the name rubella is Latin and means little red.
The Rubella virus is an enveloped RNA virus of the tocovirus family. Rubella virus is a spherical 40 to 80 nanometer positive-sense single-stranded RNA virus consisting of an electron-dense 30 to 35 nanometer core surrounded by a lipoprotein envelope. The virus particles are generally spherical with spiky hemagglutinin-containing surface projections. It's an RNA virus that replicates in the cytoplasm of the infected cell. The Rubella virus infects permissive cells via receptor-mediated endocytosis. The Rubella virus protein E1 binds both to the receptor and induces membrane fusion. The cellular receptor for Rubella virus is the myelin oligodendrocyte glycoprotein. Calreticulin, an endoplasmic reticulum chaperone protein, interacts with the 3' end of the Rubella virus RNA, cellular P32 and C1q binding protein, interacts with the Rubella virus capsid N-terminal domain. The overexpression of P32 in cell lines enhances Rubella virus ineffectivity in Rubella virus infected cells. Actin depolymerizes into filaments late in infection. An icosahedral nucleocapsid encloses the genomic RNA of the Rubella virus. A lipid bilayer envelope of cellular origin surrounds the nucleocapsid and is incorporated at the time of budding. Two virus-specific glycoproteins, E1 and E2, protrude as spikes from the ovarian envelope. Humora antibody responses are directed against the E1 glycoprotein. Viral spike proteins engineer the steps leading to adhesion, fusion, and penetration into cells. Once inside the cell, budding of capsids to form virions occur at the Golgi apparatus or the cytoplasmic membrane. The virus causes the slowing or cessation of cell division in vivo, and this is responsible for the decreased organ size in neonates. The Rubella virus is transmitted via inhalation and infects cells of the respiratory tract. It then spreads via the lymph nodes to the blood, where it induces an immune response which leads to lasting immunity. Here's the pathophysiology scene that was just described. The incubation period is 14 days, which is why the rash of rubella is maculopapular and occurs 14 to 17 days after exposure. The rash usually occurs initially on the face and then progresses downward from head to foot. It lasts about 3 days and is occasionally pruritic. The rash is fainter than measles rash and does not coalesce. Replication then occurs in the nasopharynx and regional lymph nodes. Lymphadenopathy may begin a week before the rash and last several weeks. Postauricular, posterior cervical, and suboccipital nodes are commonly involved. Viremia will occur 5 to 7 days after exposure with spread throughout the body. There is either detection of the rubella-specific immunoglobulin M or G, or detection of the virus on reverse transcriptase polymerase chain reactions. It disseminates throughout the body, and infection may affect all organs. However, in pregnant females infected, it can spread through the placenta to cause vertical transmission. The severity of damage to the fetus depends on the gestational age. Up to 85% of infants will be affected if the mother is infected during the first trimester. This may lead to fetal death or premature delivery. Hemorrhagic manifestations occur in approximately 1 per 3,000 cases, occurring more often in children than in adults. These manifestations may be secondary to low platelets and vascular damage, with thrombocytopenic purpura being the most common manifestation. Gastrointestinal, cerebral, and intrarenal hemorrhage may occur. Further complications include vertical transmission to the fetus, congenital rubella syndrome, thrombocytopenic purpura, Guillain-Barré syndrome, orchitis, neuritis, cataracts, deafness, or congenital heart disease.
Hello, how are you doing today?
Well, I have this rash, and I think I have pink eye.
Okay, let me take a look. Did you get the measles vaccinations as a kid?
Yes, actually, I had both vaccinations.
Have you had any fevers or headaches lately?
Yes, actually I have. Only mild fevers though.
Okay, I'm going to check your lymph nodes quick. Yes, they seem quite enlarged, like a cookie. Okay, so I know you've been vaccinated for it, but this rash and the symptoms you are experiencing make me think you have measles. So what I'm going to do is draw a little blood for a test, and the results will come back in 1 day. Now, just in case you have this disease, I have to recommend that you stay home until these tests come back. This is because measles is very, very contagious. Also, if the tests do come back positive, I'll have to ask you to let anybody that you've been in close contact with for the past week know.
1 day later.
Hello, this is Dr. Monster calling. Your tests have come back positive. You'll be okay. Just make sure you have lots of rest, take in fluids, and eat lots of cookies. In a week, things should clear up. Also, I would recommend Tylenol for those fevers you've been having, and a cortisone cream for the itch that rash has caused. Give us a call in a week if things have not cleared up, or if you develop a cough and other cold symptoms. This is because in some individuals, measles can lead to pneumonia.
Oh no! Am I gonna be okay, Dr. Monster?
Yes, you should be okay, as long as the disease doesn't progress. Usually, the risk for pneumonia that I talked about is more for children, although in an adult as yourself, arthritis can occur in those who have measles. So let us know if you start to experience any discomfort or pain in your joints, hands, or fingers.
Okay, will do. Thank you so much, Dr. Monster.
No problem.
Alright, a little bit about the Rubella virus vaccine. It's used to help prevent this disease in adults and children who are at least 12 months old. The first vaccine is usually given to a child who is 12 to 15 months old, and the second dose should then be given before the child starts elementary school. The MMR vaccine and the MMRV vaccine, that's the two vaccines there, they're supplied as a lyophilized or freeze-dried powder and are reconstituted with sterile, preservative-free water. The vaccines contain a small amount of human albumin, neomycin, sorbitol, and gelatin. So if you're allergic to any of these products, then you should not get this vaccine. The second dose should be given at least 20 days later than when you received the first dose. It could be given later than some childhood vaccines because antibodies transferred from the mother to the baby can provide some protection from disease and make the MMR vaccine less effective until about 1 year of age. One dose is 93% effective against measles, 78% effective against mumps. and 97% effective against rubella. 2 doses are 97% effective against measles and 88% effective against mumps. This virus vaccine is an attenuated or weakened live virus vaccine. This means that after injection, it causes a harmless infection in the vaccinated person with very few, if any, symptoms before they're eliminated from the body. A person's immune system will then fight the infection caused by these weakened viruses, and immunity will then be developed within that patient. However, there is still a chance of developing one of the diseases even after receiving both vaccines. About 3 out of 100 people who get 2 doses of this vaccine will get measles if exposed to the virus. However, they're more likely to get a milder illness, and they're also less likely to spread the disease to other people. 2 doses of this vaccine are 88% effective at preventing mumps, but it can still occur in highly vaccinated U.S. communities, particularly in settings where people have close, prolonged contact, such as at universities and close communities. During outbreaks, public health authorities may recommend an additional dose of MMR for people at increased risk, and you should not receive a booster vaccine if you've had a life-threatening allergic reaction after the first shot. Like I said before, you should not receive this vaccine if you're allergic to gelatin, neomycin, or if you've had a life-threatening allergic reaction to any vaccine containing rubella. You should also not receive this vaccine if you have a blood cell disorder, such as anemia, blood or bone marrow, cancer such as leukemia, lymphoma, and others, severe acute respiratory suppression caused by diseases such as cancer, HIV, or AIDS, or by receiving chemotherapy or radiation, or if you are pregnant. Before receiving this vaccine, tell your doctor if you have any side effects from this vaccine.